Good morning, everyone. The update for today is that we do have 21 new cases that have been identified in South Dakota. Of those 21 cases, no individuals have been hospitalized due to their illness. We have seven new individuals who have recovered from COVID-19. Unfortunately, we have one new death to report. We added 294 additional negative tests, and in total, we have 129 COVID-19 cases in the state of South Dakota. We have 2 total deaths, and we now have 51 individuals who have recovered from the virus. The counties in which these cases are a county of residence in which these cases reside: 1 from Beadle County, 1 from Brown, 1 from Hughes, 6 from Lincoln, 9 from Minnehaha, 1 from Roberts, and 2 from Yankton. The age groups of these positive cases: we have 1 person in the 0 to 19-year age group, 2 individuals in the 20 to 29-year age group, 2 individuals in the 30 to 39-year age group, 6 individuals in the 40 to 49-year age group, 6 individuals in the 50 to 59-year age group, 3 individuals in the 60 to 69-year age group, and 1 person in the 80-year and older age group. The breakdown by sex: we have 13 males that were identified as new cases, as well as 8 females. A quick note is that yesterday we had identified a case in Kingsbury County that has been updated to reflect their residents being in Brookings County. As far as the community impact map, we have no new counties with community spread to report today.
Thank you, Dr. Clayton. Now we will take questions. Does anyone have questions for us today?
Dr. Clayton,
Dr. Clayton, could Brookings Radio?
Go ahead.
I think you may have just answered my question, but I want to confirm, because Brookings County now lists 2 cases, both already recovered. I assume that's because the one was previously Kingsbury County?
That is correct.
Thank you. Just wanted some clarification. Appreciate it.
Certainly.
This is Jody Heemstra, Dakota Radio Group in Pierre.
Go ahead, Jody.
The new case in Hughes County, I see 2 listed now. Is that related to the case in the inmate that is in the women's prison?
No, that case is not associated with the previous case. This is a new individual.
Thank you. Is it someone who may have had contact with the 9 inmates that escaped and then were brought back?
All the testing on the individuals who have been reapprehended, none of those individuals tested positive, so that would not be a risk to the community.
Thank you.
Dr. Clayton, Megan Merritt with News Center 1. In regards to the employee at the Black Hills VA who tested positive, can you specify which facility that person worked at and how many potential transmissions you might be looking at?
So what I can say is that when we do identify cases in healthcare facilities, we do work with those facilities. The information around where that individual worked is going to be released, or is left to be released by that individual facility. So that's the information that I have at this time.
Can you speak to how many people might have been in contact with that employee?
We are still working with the healthcare facility to identify individuals who do need to be contacted and monitored. And so this is typical of what we do with all of our, any sort of exposure that occurs in a healthcare setting.
Okay, thank you.
What county is the new death from? Register?
The death occurred in a Beadle County resident.
Any information on the
Dakota Territory News.
Dakota Territory News?
Yeah, so we're curious about what goes into the process of identifying the businesses that some of these folks are working in. Just in regards to, say, the saloon number 10, they say that they've been the only business to be notified outside of healthcare facilities personally. So I'm interested to know, at what point do you guys decide that you need to make a certain business public?
This is Kim Malsom-Ryson with the Department of Health. So in our investigatory process, we identify the situation of any positive cases, who they may have been exposed to. In situations where positive cases have been in public places where we are not able to identify specific contacts, but know that they have been in contact with other members of the public, we will issue a public notice like we had to do yesterday for that particular business. That is not unusual. We've had to do that in other disease investigations in the past. This is obviously the first time that we've had to do it with the COVID disease this year.
So they feel somewhat singled out. So all of these other 100+ cases, none of those folks have jobs in which they come into relative contact with the public?
Not where, so the difference would be if a positive case can identify specific individuals who they would have come into contact with, whether that's related to employment or other situations.
And one of the things that I would like to note is that individuals have been doing a relatively good job of, when they identify symptoms of COVID-19, that they are, staying at home, notifying their healthcare provider of their symptoms to avoid some of those exact exposure potentials as well.
Thank you. Next question.
Jeremy Fiegelberg from News Service.
Go ahead.
Yeah, just a question on the fatality of whether if you're releasing the age and gender of that patient, and if not, why not with this patient, but you did with the previous fatality?
So the focus that we have is on maintaining as best as possible the confidentiality of individuals, and so we try to be cognizant of the current situation, and the information that we have started to provide is focused on trying to help ensure that individuals are able to maintain some confidentiality as we're identifying individuals in smaller communities that might be more readily identifiable. So we just want to make sure that we are helping to maintain the confidentiality of those individuals. We do conduct contact investigations, and so folks that are close contacts to those cases are being notified of their exposure by the Department of Health. So that is, how we are handling both notification as well as larger awareness of our current case counts on the website.
Okay, I appreciate that. And that's then on this new fatality as far as additional information.
That's correct.
Okay, thanks.
This is Jill at the Brookings Register. Can you tell
Jill,
me
go ahead.
what standards or requirements are used to consider somebody recovered? And then also the Kingsbury County case that moved to Brookings County was first reported yesterday, and it's already listed as recovered. What's happening there?
So a little bit of that is just based on the timing in which individuals are seeking care from when their symptoms first begin, and because that does have direct relation to how quickly they're going in or coming out of being listed as recovered. So the criteria that we use are that an individual must be at least 7 days after their onset of symptoms, and that they have at least 3 days of no fever before they are released from isolation, as well as the generally improvement of other symptoms, So if they have cough, they have a decrease in the severity of cough. So the focus there are those three criteria in order for an individual to be considered recovered, and then that individual is allowed to continue their daily activities within the community and are no longer restricted or isolated to home.
Okay, thank you.
Excuse me, Trevor Mitchell with the Argus Leader.
Argus Leader, go ahead.
Yeah, we've spoken with family of the confirmed second death who said there was the death occurred Saturday and positive test results came in Tuesday. I'm wondering if you could talk about what the process is for determining whether a death occurred from COVID-19.
So the main focus around individuals who die from COVID-19 is that they do have a positive laboratory test in order to identify that they were infected with COVID-19 either at the time that they died or as a direct result of the illnesses that they may be dealing with after hospitalization and other things like that. So it is an underlying COVID-19 is required to be an underlying cause of their current illness that led to death, and that's being reported on their death certificate, and that we receive that information here at the health department.
Right. Was this in these cases? Can you say whether this was a posthumous test for coronavirus?
We don't get into the details of how the sampling was done. What we can say is that both of the decedents that we've had in the state have tested positive for COVID-19.
Okay.
Michael from Kellaway, I believe you had a question next.
Michael, this is Kim Alsam-Reisden. We are familiar with that model. What is not very transparent about it, however, is how they are actually measuring the impact of those community mitigation factors. And so we can't really comment on, how realistic their numbers are as associated with those community mitigation numbers. So we are aware of it. We are always looking at all new models to help inform our response efforts.
Great. We'll take one more question for the day.
This is Carlene Wild from Dakota News Now.
Go ahead.
I am curious. So this, the deceased, the most recent person to pass away from this, the family has chosen to self-identify. And one of the things that I think we've learned is that the symptoms came on incredibly fast, and she was gone before she had a chance to even get to the hospital in Sioux Falls, is what we're understanding. Do you have any idea, are there different levels of how COVID may be impacting those? I mean, we've been talking about this a little bit, but is there a different severity in terms of how someone otherwise seemingly healthy might come down with this, or where are your thoughts there?
So yeah, I think it's important to recognize that 80% of individuals with COVID-19 will develop only a mild, to moderate respiratory infection. For those individuals that do, progress in their disease, about 15% of those individuals end up requiring hospitalization. A smaller subset of around 5% of those individuals require advanced care, and 1% or so end up dying from COVID-19. The exact presentation is always going to be a little bit different for individuals. The focus here is that a lot of what we see for COVID-19 deaths have been individuals who have progressed through their illness. The underlying factors that may have contributed to the speed at which the illness impacted the decedent that's been announced today is not fully known, but what I would say is, given what we've seen both nationally and internationally, the typical presentation is an individual who goes through that progression of illness over a longer period of time.
So this was pretty rare.
Yeah, that's what I'm getting down to, is that
Okay.
the presentation that we've seen is not the typical presentation.